SBAR is an easy-to-remember mechanism that you can use to structure conversations, especially of a critical nature that require a colleague's immediate attention and action. It enables you to clarify what information should be communicated between members of the team and how. The tool will help you to anticipate the information needed and formulate this information at the right level. Although SBAR can be used to structure a referral letter, it is more commonly used to refer a patient to another specialty verbally. It can, however, also be used when discussing a patient with the nursing staff or with senior colleagues. It may also be useful at the end of a shift when communicating with another colleague, and it can also be applied when escalating a concern. S defines a situation. Explain who you are and where you are calling from. State your patient's name, why you are calling and what your concern is. In this example, a maxillofacial SHO is contacting the on-call medical registrar out of hours regarding an inpatient who has become unwell. Hello, medical registrar.
Hello, this is Claire, the Maxillofacial SHO.
Hi there.
I'm calling from Ward 12 at City Hospital regarding a 76-year-old patient called Irene Taylor who's been having severe central chest pain for the last 10 minutes.
Okay.
She's tachycardic at 135 and her blood pressure is 90/55. We've put her on high flow oxygen and she's saturating at 100%. She's anxious and obviously distressed with the pain. In addition to the oxygen, we've given her IV morphine, a buccal nitrate and 300 milligrams of aspirin. Her ECG is abnormal.
B stands for background. Explain why your patient is in hospital and mention her medical history, including medications and the results of any recent and relevant investigations. You need to have your patient's chart and medical records at your fingertips for any questions that you are asked.
Mrs. Taylor was an elective admission 2 days ago for excision of a skin cancer from the left cheek under general anaesthetic, and before these recent developments her recovery had been uneventful. She has a history of ischemic heart disease and she had a stent placed 7 years ago, but she has no firm history of an MI. Otherwise she is hypothyroid. She usually takes amlodipine, bendroflumethiazide, simvastatin, aspirin and levothyroxine.
A stands for assessment. Explain your impression or diagnosis. Why is your patient in the condition she is in? You don't really need to have a diagnosis, and if this is the case, you must highlight this. Don't make things up.
Based on her medical history and symptoms, I suspect she is having an MI.
Or, if you are unsure of the diagnosis, explain this but highlight your concern. For example,
I'm unsure of the cause of her symptoms, but I am very worried about her.
R defines the recommendation to the person you are referring to. Make suggestions and explain how you wish them to get involved. If they say something you are uncertain about, then ask them to clarify it, and don't forget to ask them for their name and grade, and make sure to document it.
I would like you to come and see this lady urgently. Are there any tests you would like me to get, such as an arterial blood gas, chest x-ray and some routine bloods?
Yeah, please get all of those.
When are you going to be able to get here, and do you require any further information?
No, that'll be fine. I'll be around 15 minutes.
Can I take your name and grade, please?
It's Dr. Haywood, ST5 in General Medicine. Here are a few tips you might find useful if you are using SBAR. Before a conversation, do write a few things down as an aid memoir. And do not be anxious about giving your recommendation even if you have little experience. It is well that you voice your concern. Do not be afraid to repeat yourself. The person you are speaking to is likely to be as tired as you are and may not always be able to absorb everything first time. And lastly, if you are asked a question and you don't know the answer to this, simply state this and do not make anything up.